Imagine being a superhero with a nice shining suit and a nice flowing cap, but a superhero with no superpowers. No super flying powers, no super strength powers, no powers to teleport, and you could literally not save anyone. I'm the youngest of the 15 practicing psychiatrists in my country, Zimbabwe. And Zimbabwe is a country with just about 14 million people. This means there is literally one psychiatrist for every 1 million people. And for me to be joining this small team of specialists felt like such a big honor. It, however, came with some discouragement from my family and friends who thought I could have chosen a cooler career pathway, like being a cardiologist or a neurosurgeon or even a pediatrician, given my bubbly personality. But I stuck to my guns and pursued my career in psychiatry. Fast forward to a few years when I was now working at one of the referral psychiatric hospitals in the capital, Harare. I met Tatinda. Tatinda was a 10-year-old boy who came to the clinic in company of his mother. And as we exchanged greetings, I noticed they had a big bag. And I inquired about the bag out of curiosity, and the mother shared that they had traveled over 5 hours to come the previous night and slept on the emergency bench just so they could make it in time for their psychiatrist appointment the next day. This was all because Tatinda had been struck by lightning at the beginning of the rain season. Now, the rain season in Zimbabwe is about 4 months, and he had missed school on every single rainy day because of the severe anxiety symptoms he was now experiencing due to this traumatizing event. My heart sank, not only for the trauma that Tatinda had experienced, nor for the long journey they had had to endure to come and get help, but for the fact that I also knew that Tatinda was not going to get comprehensive care, and he had a very little chance to full recovery because the treatment that he needed, a series of therapy sessions, was not going to be available in his hometown. It was moments like these in my career that made me to reflect and start thinking whether I had made the right choice, whether I was really going to make an impact in the lives of people as I had imagined. Was I not going to be just another superhero with no superpowers to make a difference in my community? This self-searching journey led me to getting a role with one of the most innovative interventions in Zimbabwe, the Friendship Bench. The Friendship Bench is a mental health intervention that follows the task sharing model. It trains lay health workers to provide problem-solving therapy in a simple but effective way. The lay health workers who are trained on this intervention are elderly women who the community affectionately refer to as gogos, which means grandmother in my local language. These gogos have been able to serve over 5,000 clients every month on wooden park benches in the various community and rural benches in Zimbabwe. On one of my interactions with the grandmothers, I met Gogorudo. And Gogorudo shared a very disturbing story about her work. On one of her work days, she had done about 2 sessions, and she was just about to call it a day when a young lady approached her. The young lady was depressed, and she had suicidal thoughts that she could no longer ignore. Gogorudo realized that the young lady needed the input of the nurse. She immediately reached out to the nurse who was around for supervision, but unfortunately, the nurse had her hands full. She had 2 imminent deliveries in the maternity wing. After over an hour of waiting, Gogorudo had to make the hard decision of sending the young lady home, with an option either to come back to the clinic the next day or use the little money that she had to take a bus to the psychiatric hospital in the capital city. The young lady had been left hanging in the channel of care. I can take a guess and imagine. On that night, three individuals did not get a wink of sleep. Gogoruro, exhausted and worried about a client whom she didn't know would leave to see the next day. The nurse, feeling guilty about not having been able to even listen to the young lady's story. And of course, the young lady, feeling overwhelmed with feelings of sadness and thoughts of taking her own life. For more than a decade now, we have hit the call to action to scale up task sharing mental health interventions like the Friendship Bench. Interventions that are ensuring that at minimum, people young like the young lady in my story have someone, a grandmother, sitting on the bench waiting to listen to their story and provide psychological care. However, when we create these task sharing mental health interventions, we have an ethical obligation to ensure that people who need higher levels of care can receive this care. This can be done by ensuring that the minimum number of mental health specialists are in place before the task sharing intervention is implemented. These mental health specialists also need to be capacitated with mentorship and supervisory roles as they get into the task sharing intervention. The supervision and mentorship can be offered physically or virtually, and above all, the tools, resources, and medications needed to diagnose and to treat people with moderate to severe mental health disorders need to be consistently available to avoid frustrating the nurses and the mental health specialists who need this for their work. For the well being of the grandmothers, it is important to ensure that we do not overwhelm them or burden them with cases of moderate or severely ill mental health patients who are beyond the scope of their work. Putting these and other measures in place ensures that we create a seamless, efficient referral pathways, which ensures that people like the young boy Tatenda or the young depressed lady in my story are not left hanging in the care of care. It ensures that the well-being of the mental health specialists like myself, the nurses, or the lay health workers like Gogorudo is not compromised, and hence making them superheroes with no superpowers. I know someone is going to ask and say, are they really superheroes? Well, I think they are. In their own small, special way, they wake up every day and they make a difference in the world, one client at a time.